Decolonizing Healthcare, Indigenous Digital Storytelling as a Pedagogical Tool for Cultural Safety in Healthcare Settings. My name is Shelley Wiart. I am a member of the North Slave Métis Alliance, Yellowknife Northwest Territories. I acknowledge that I reside on the traditional lands referred to as Treaty 6 Territory and the homeland of the Métis. Last summer and this summer, I was the recipient of the Alberta Indigenous Mentorship in Health Innovation Undergrad Summer Student Stipend. Last summer, I was also awarded the Haudenosaunee Northwest Territory Spore Support Unit Researcher Capacity Development Grant for our Indigenous Women's Digital Health Stories research. Indigenous women's health stories are complex due to their intersecting identities of race and gender, their experiences of colonialism, and social determinants of health. All of these factors can make it challenging for them to access culturally appropriate healthcare. Healthcare providers often fail to create an environment of cultural safety, defined as an outcome where Indigenous peoples feel safe and respected from racism and discrimination when they interact with the healthcare system. From May to June 2019, I co-created 2 digital health stories with Indigenous women from the Lloydminster Onion Lake Cree Nation area on the border of Alberta and Saskatchewan. I relocated to Yellowknife for the months of July and August and co-created 3 digital health stories with women there. I conceived of this project as community-based participatory action research carried out through the lens of Indigenous feminism, which centers the participants as the person most knowledgeable about their own experiences. I incorporated an integrated knowledge translation plan that allowed the participants to share their ideas about how to disseminate the research and their digital stories to the community. Our knowledge translation event, Legacy, Indigenous Women's Health Stories, premiered the 5 digital stories on August 15, 2019 in Yellowknife, Northwest Territories. Indigenous digital storytelling within the framework of Indigenous research methodologies allows Indigenous women to share their health stories in a safe and respectful context. This decolonizing methodology allows for self-representation that challenges stereotypes and allows Indigenous communities to prioritize their own social and community needs and to protect their identities and cultural values in the process. There was a feeling of empowerment by the storytellers that identified their own healthcare providers in the audience. It allowed the participants to address the power differentials between patient and doctor and communicate their health needs in a respectful way. A participant stated, "I was nervous. The relationship that I have with my doctor is rocky because I have to fight for a lot of things that other people don't have to fight for." And so when she was in the audience in the workshop and me speaking about knowledge translation and the difficulties that I face with healthcare professionals, I was nervous. But at the same time, it was empowering because she had to sit there and listen to what I had to say. Indigenous women's health stories can serve as a pedagogical tool to teach cultural safety in healthcare settings. Indigenous digital health stories inform solutions that are community-driven, culturally relevant to Indigenous peoples, and based specifically in local knowledge. These stories are an innovative way to decolonize healthcare, build relationships and trust with healthcare providers, and seek collaborative solutions to reconciliation in healthcare. The most important aspect of this research has been the formation of empathetic connections between healthcare providers and Indigenous women's stories of cultural genocide, such as the forced removal of Indigenous children to residential schools, and how it manifested in Indigenous people's physical, spiritual, mental, and emotional health. Indigenous women's health stories are a form of reconciliation in healthcare because they assist medical professionals in understanding their own positionality and reflect on the ways that they may disrupt the systemic racism embedded in our institutions. Thank you.